Hidden infections, how sleeper germs could be impacting your health. Introduction. We often associate infections with immediate symptoms, fever, cough, or fatigue. However, hidden infections, sometimes called sleeper germs, can persist in the body silently for years, only becoming active under specific conditions. These latent infections have been increasingly linked to chronic diseases, including diabetes, heart disease, neurodegenerative conditions, and even cancer. New research is shedding light on the stealthy nature of certain viruses, bacteria, and other microorganisms that can evade detection, weaken the immune system, and trigger long-term health issues. This article explores the latest insights into hidden infections, their connection to chronic diseases, and scientifically supported methods to reduce their impact on overall health. Understanding sleeper germs, hidden infections, and their impact. What are hidden infections? Some pathogens don't cause immediate illness but instead remain dormant in the body for years or decades. These infections can be latent viruses, some viruses like herpes simplex virus, HSV1, HSV2, Epstein-Barr virus, EBV, cytomegalovirus, CMV, and varicella zoster, shingles, can integrate into human cells and reactivate under stress, aging, or immune suppression. Persistent bacteria, chlamydia pneumonia and mycoplasma have been implicated in heart disease, stroke, and autoimmune disorders. Stealth microbes, some pathogens like Borrelia burgdorferi, Lyme disease, and Helicobacter pylori can evade the immune system and cause chronic inflammation. These infections may not trigger obvious symptoms, but can wreak havoc over time by chronic immune activation, inflammation, and organ damage. The link between hidden infections and chronic diseases. 1. Hidden infections and diabetes. Emerging research suggests that persistent viral and bacterial infections may contribute to insulin resistance. Chronic inflammation from infections such as CMV or Helicobacter pylori has been linked to impaired glucose metabolism. Gut microbiome imbalances caused by infections may disrupt insulin signaling and increase diabetes risk. 2. Atherosclerosis, stroke, and heart disease. Scientists have identified bacterial DNA, chlamydia pneumonia, and mycoplasma in arterial plaques, suggesting that infections trigger chronic inflammation in blood vessels. Cytomegalovirus, CMV, may accelerate arterial thickening, increasing the risk of stroke and heart attacks. Viral infections may indirectly contribute to high blood pressure and clot formation. 3. Neurodegenerative diseases, Alzheimer's, Parkinson's, ALS, multiple sclerosis. Herpes viruses, HSV1, HHV6, have been found in the brains of Alzheimer's patients, raising questions about their role in neurodegeneration. Amyloid plaques, a hallmark of Alzheimer's, may be a defense mechanism against viral infections. Chronic infections can lead to ongoing brain inflammation, which damages neurons over time. 4. Cancer and hidden infections. Certain viruses have been directly linked to cancers, such as human papillomavirus, HPV, and cervical cancer or Epstein-Barr virus, EBV, and lymphoma. Helicobacter pylori, H. pylori, a bacteria found in the stomach, is a leading cause of gastric cancer. Persistent infections may trigger chronic immune responses that promote tumor growth. How hidden infections enter and persist in the body. From parents to offspring, viruses and bacteria can be transmitted during pregnancy or childbirth, through vaccinations or contaminated medical products. Some live virus vaccines may carry unintended microorganisms that persist in the body. From environmental exposure, food, water, air, and personal contact can introduce sleeper germs. Through immune suppression, stress, aging, and poor nutrition can reactivate dormant infections. Protecting yourself. Strategies to reduce hidden infection risks. 1. Strengthen the immune system. Adequate sleep. Poor sleep reduces immune function, increasing the risk of infection. Manage stress. Chronic stress weakens immunity and can reactivate latent viruses. Daily physical activity, regular exercise boosts immune function and reduces inflammation. Second, nutritional strategies for defense. Certain nutrients have been shown to support immunity and reduce viral bacterial load. Vitamin D3 regulates immune responses and reduces inflammation. Selenium deficiency has been linked to viral persistence and mutation. Zinc essential for immune cell function and reducing viral replication. Curcumin from turmeric demonstrates anti-inflammatory and antiviral properties. Garlic extract contains allicin, a potent antimicrobial compound. Probiotics help maintain a balanced gut microbiome critical for immunity. 3. Reduce exposure to environmental triggers. Limit processed foods and sugar, as these promote inflammation. Minimize exposure to heavy metals, e.g., mercury, aluminum, that can disrupt immune function. Consume organic foods when possible to reduce exposure to pesticide-induced immune stress. Fourth, regular medical checkups. Screening for latent infections, e.g., CMV, EBV, Lyme disease, can help identify hidden risks. Monitor inflammation markers, CRP, IL-6, to assess immune system activity. Debunking myths. Do vaccines or supplements cure hidden infections? There is no universal cure for hidden infections, but lifestyle and nutritional strategies can help reduce their impact. Vaccines may protect against certain infections but do not eliminate dormant viruses already in the body. Supplements can support immune function, but they do not eradicate sleeper germs completely. Disclaimer. This article is for informational purposes only and does not replace medical advice. If you suspect a hidden infection, consult with a qualified healthcare provider for proper evaluation and guidance.